And September saw some of the worst performances on record for A&E waiting times and levels of delayed discharge. Earlier I spoke to Dr. John Paul Loughrey, Vice President of the Royal College of Emergency Medicine in Scotland. He's looked at the numbers. He says 165 patients could have died unnecessarily last month because of this. He also told me he's seen the October results. They look to be even worse.
The main issue just now is about what we call exit block. So that is the term that we use for getting patients who've been seen in emergency departments, they've been assessed by emergency clinicians, and they're deemed to require admission to further care, whether that's a medical ward, a surgical ward, etc. And there just isn't the capacity in the acute care systems to admit them to. That then causes overcrowded emergency departments who are designed and trained to look after patients for short periods of time. That's the reason that we have a 4-hour target, is because most care for emergency patients can be provided in that time. It's not the environment to spend 24 or 48 hours in. It's noisy, it's overstimulating, and it's not staffed to look after those volumes and numbers of patients. That then means that patients coming to the hospital in ambulances can't be offloaded in a satisfactory time into the cubicles, which then washes the pressure out into the communities, into patients sitting in GP surgeries or at home wondering when ambulances will be able to respond to them.
I'm looking at a quote that you've given earlier on about what you're saying directly to the Scottish Government.
Yeah, this issue is not something that can be dealt with within emergency departments or emergency medicine itself. This is the deepest and worst crisis we've seen in emergency care in a generation. It's certainly the worst that I've ever experienced in my career. If we could manage to make some reduction of those patients in hospital that are currently delayed discharges of care, so there's about 1,800 patients now, or 1 in 6 acute beds currently occupied by patients whose discharge has been delayed from hospitals. If we could make a dent in that, then it might go some way to mitigate the risk that's currently being experienced in acute settings and in particular in emergency departments.
But the quote I'm looking at says you say the Scottish Government must get a grip of this crisis.
Yes, this is the deepest crisis that we've experienced in a generation of emergency care. And some of the figures and some of the stark data that's been published this month on the numbers of 12-hour waits and numbers of 8-hour waits in emergency departments suggests that this is by far the worst that we've experienced. October's numbers are yet to be published. They'll be in a month's time. We are a week of data still to be published for those, but already I can see that the data for October is going to be even worse. And unless urgent changes are made, then November and December won't be much better either.
We'll come to the changes, but are people dying unnecessarily because of this?
Well, yeah, there's very good data published in the Emergency Medicine Journal where it examined patients who had excessive waits in the emergency department, and there's a very strong and clear association with long waits in emergency departments and increased mortality at 30 days. So spending more than 6 hours in the emergency department, if there's 82 patients who do that, if there is one excess death. Using these statistics that have just been published for the month's data for September, there's over 150 potential excess deaths as a result of that. And that's before we even look at the impact of increased lengths of stay. If you stay longer in an emergency department in an inappropriate setting, it's possible that the quality of care, not just for you, but for all patients in that department, is diminished, and that does potentially lead to increased length of stay within hospital as well.
All right, help me then. So you've done this study between staying longer than 8 hours before you're admitted or discharged or transferred, and we've got, according to the numbers I'm seeing for September, 13,500 patients waited more than 8 hours. And the sum that you've got is that, therefore, how many patients died because of this?
So as an association, approximately 165 patients would have had an excess death within that 30-day period. So that's the numbers that pan out for actually over 6 hours. We don't collect the 6-hour data in Scotland, it's just 8 hours. So potentially we're missing some small number of patients between 6 and 8 hours where there is still an increase in risk. So we don't know exactly how bad that risk gets when patients spend more than 12, 24 hours in an emergency department as well.
You're saying what we need to do is free up the care system or the kind of exit from hospital system. And that's not happening. So what needs to be done there?
So a combination. We are short of acute beds. There has been a reduction in the acute beds in Scotland over the last 10 years, and we in the Royal College believe that we're around 1,000 acute beds short in Scotland. That's before we really take into account the large numbers of patients and record numbers of patients that now have delayed discharges from Scottish hospitals. So one, an increase in the acute staffed bed base, and that's the important thing. Some of these beds do exist, but actually staffing them with the appropriate levels and training of staff is something that needs to be addressed urgently. And two, improving the access to social care urgently, and that means sometime in this winter period and not something that we can look forward to in 4 or 5 years. As I've said, the data for October is going to be worse again, and certainly all signs are that we're in for an extremely difficult winter.
Hundreds of people are dying unnecessarily because of this, according to your numbers.
Potentially, yes.
I mean, that's quite extraordinary, isn't it? So that's Dr. John Paul Loughrey from the Royal College of Emergency Medicine Scotland, a spokesperson for the Scottish Government, told Drivetime the Health Secretary's been upfront about the challenges facing the NHS. Pandemic backlogs, Brexit-driven staff shortages and inflation costs have all contributed to make this the most challenging winter the NHS has ever faced. Our £600 million winter plan, which will see us recruit 1,000 new NHS staff, including up to 750 frontline nurses from overseas, our £50 million urgent and unscheduled care collaborative looks to drive down A&E waits by offering alternatives to hospital. Now, while Scotland's A&E performances continue to be the best of all 4 nations, our performance is not where we want it to be. We're making good progress in addressing the backlog of planned care. Recent figures show 2-year waits are clear in the majority of outpatient specialists, and by the end of September, more than half of inpatient specialities had fewer than 10 patients waiting over 2 years for treatment. You're listening to Drive Time.